Hello, good evening, everybody. My name is Kevin Koser. I live in Virginia, so I'm the Virginia State Lead for Advocacy, and I've been co-chair in this position for, I guess, the 2 or 3 years now. I'll be kicking off the training tonight. This should be a fairly short one. We scheduled about 30 minutes. We have about 9 or 10 slides. It's going to be focused on just trying to get you up to speed about, number one, what is the bill? And then how are you going to have an effective day during our virtual advocacy day coming up? Next slide, please. So here's the agenda. Like I said, we're starting off with just a brief overview of the bill and what is happening here in the 117th Congress. Then we'll talk about what to expect during your advocacy day virtually on the Hill. And the second half, Becky will be discussing how to prepare, how to tell your story effectively, and how to build relationships with these offices. Then we'll follow up with any questions. Just a reminder, there is a Q&A box or the chat box. Either one is fine. So feel free at any point during this presentation to type in questions, and we'll address those at the end. Next slide, please. So the Ensuring Lasting Smiles Act is a bill that aims to ensure that all private health insurance plans handles claims for medically necessary treatments of congenital anomalies equally and fairly. For the ectodermal dysplasias community, that's where we're having issues receiving dental treatments and oral treatments related to the mouth and the lack of teeth. And what insurers have been doing is denying treatments on the basis that they're either cosmetic or not medically necessary, and they try to defer it to dental insurance. What we found out over the last couple of years is that this is not an isolated thing. It's not just related to the mouth and the teeth. So what we're trying to do is make sure that all congenital anomalies are treated equally and fairly. The foundation for this bill is based off of state statutes that exist in all 50 states. So it's a very solid foundation. And those state statutes require insurers to offer coverages of these medically necessary repairs for congenital anomalies. So that's what the federal bill is aiming to do, is trying to make sure that those types of state laws are enforced across the board, and it makes it a federal law so we don't have to worry about unequal or differing language within the state statutes. So about 4% of children in the US are born with a congenital anomaly. I mentioned some of the oral defects associated with ectodermal dysplasia, but there's others, cleft lip and palate, which affect some, and as well as other conditions. You'll see skeletal defects, vision defects, hearing defects, and other losses of bodily function. We found that this is insurance denials are happening across the board in many cases with the same type of thing. If a doctor or physician is telling you that you or your child or somebody you love or take care of requires medically necessary treatment, you assume that a health insurance plan is going to approve that because the physician is saying it's medically necessary. Unfortunately, the insurers are finding ways to bypass the state laws and bypass even protections within their own plans by claiming that it's either cosmetic or not medically necessary. So that's what ELSA is trying to do, is close these loopholes. Bottom line, if you're on this call or on this Zoom meeting, what we're trying to do is make sure that any medically diagnosed congenital anomaly that requires medically necessary treatments would benefit from the passage of this bill. Next slide. So what you'll see here is ELSA in the 117th Congress. So you might be wondering, what is the 117th Congress? It's a congressional session. So every congressional session lasts for 2 years. The 117th Congress covers the year 2021 to 2022. So we're just at the beginning. We're about 3 months into the 117th Congress right now. And this is the third congressional session where ELSA has been introduced on Capitol Hill. We started off with an enormous amount of support in both the US House and the US Senate. And over the last 2 weeks since it was reintroduced, we've gained even more co-sponsors. So as you'll see here in the Senate, we have 32 bipartisan co-sponsors, plus our primary, who's Senator Tammy Baldwin. And in the US House, we have 156 bipartisan co-sponsors, plus our primary, Congresswoman Anna Eshoo. We have a great team of bill leads in the House and the Senate. what we have is a Democrat and a Republican who have agreed to be leads in both chambers. So Tammy Baldwin and Senator Joni Ernst, and then Congresswoman Anna Eshoo and Drew Ferguson. The bill has been referred to a couple of committees. I'm not going to get into details on that. I know we'll probably discuss committee assignments and committee actions during the later training session during the month of April. But just know that the bill has been referred to a couple of House committees and one Senate committee, and we'll discuss the significance of that at a later time. Next slide. So during the legislative day, virtually day on the Hill, you're going to find yourself assigned to anywhere from 3 to 5 legislative meetings. Most of you are likely going to only be in 3, and that's aligned to your 2 U.S. senators and your 1 U.S. representative. These meetings usually take about 15 to 20 minutes. Some of them will go a little bit longer. Some of them might be a little shorter depending on who's in attendance. But what we're trying to do is place you in meetings with other ELSA advocates, so that way you're not the only one. Each advocate will have about 1 to 2 minutes to speak, and that's going to be when you're sharing your personal story. You know, there might be some meetings where you are the only attendee, but don't be afraid. It's a really fun and easy thing to do. It really is just storytelling and talking to the congressman, congresswoman, the senator, or their staff about why the Ensuring Lasting Smiles Act is important to you and how congenital anomalies have impacted your family or friend or your patients or anybody that you might know. Again, this is completely virtual. So most meetings are going to be, most of them are going to have a video conference option. Some of them will not. Some of them will just have a phone number that you conference call into. You'll receive an online schedule a couple of days, maybe a week or so in advance. And what we'll be including in that email in your schedule are the key talking points, some background information about your congressional member. It'll also, like I mentioned earlier, it'll discuss specifically whether that member of Congress is on a key committee for ELSA. And again, we'll discuss all the details of that at a later training session. But in general, just keep in mind, like, there's a couple very easy ways to be successful. Arrive early, don't be late, obviously. It never looks good to be late to a meeting. Make sure that you mute yourself while others are speaking. We're going to focus heavily today on sharing your personal story. That's the most critical part of advocacy, is sharing your personal story. And that's what members of Congress and their staff want to hear. And we always like to remind people, please be kind. I know people have very different political opinions and personal opinions of members of Congress. It's just the nature of democracy in America, but we always want to be kind and remember that most staffers have an extremely, extremely busy day. They're taking dozens of meetings and phone calls, and they receive hundreds of emails daily. So we want to be kind, courteous, polite, stand out in a positive way when we're discussing the Ensuring Lasting Smiles Act. Next. And I'll be followed up by Becky Abbott.
Hello, everybody. So when we talk to our legislators or legislative staff, we will have an ask of them. And on the screen right now are the 2 different asks that we will be talking about. And you will not talk about both of them. It will be one or the other. So if you have a member who is not a co-sponsor, you will be asking them to please support and co-sponsor the Ensuring Lasting Smiles Act. If you have a member of Congress that is already a co-sponsor, then you would thank them for their support and thank them for co-sponsoring the Ensuring Lasting Smiles Act. And then we would also ask them to please reach out to their colleagues, committee leadership, committee members, if a member is a member of one of the committees, and indicate their support for the Ensuring Lasting Smiles Act, and then also prioritize the passage of the Ensuring Lasting Smiles Act in the 117th Congress. So you may be asking yourself, how do I know if one of my legislators has signed on and has co-sponsored the Ensuring Lasting Smiles Act? And there's 2 links that we'll make available to you. They're also available on our website, but you can click on congress.gov and enter in the bill numbers. And there is a list of co-sponsors in the US House and the US Senate. And once you go onto those links, you'll be able to figure out very easily whether or not your legislators have co-sponsored. We will also have that information readily available on the schedules that you receive. So if you don't know how to look that information up, or you forget, you can always go back to your schedules and find that information easily. So what you need to do to prepare for your meetings. First of all, you need to write out your personal story, or if you're a specialist or a healthcare provider and you're attending, then you would need to share a patient story. Make sure that you write it out ahead of time so that you can edit it down and revise it and start practicing your story. As Kevin said, you'll only have a couple of minutes, so you need to pick out the information that is most relevant and that will catch the interest of the member of Congress. So those specific things would be why you are asking your member of Congress to co-sponsor and support the Ensuring Lasting Smiles Act. Why is it important to you, and why are you advocating for it? Also, you need to include if you've had any insurance struggles, or if you are in the future, you will be having insurance struggles. You need to make sure to include exactly how much you think you're going to be paying, or the different types of treatments that your family member or loved one will be having, so that that member of Congress or their staff exactly knows what you're going to be going through and understand why they need to help and support you by supporting this legislation. Feel free to prepare notes and materials for the meetings. I know that I always prepare notes for the meeting, and sometimes I read off of them. You know, during the meeting, you forget something, and you can always go back to your notes so that you hit all of the key talking points. As far as your schedules, they will be emailed to you. So look for those schedules. They usually get to you about 5 to 7 days before the actual event day. So check your emails often so that you don't miss those. Once you get your email that has your online schedule, then you would go in and you would access your online schedule and you would review it. If you review it and you notice that there may be 2 conflicting meetings, or there's an issue with one of them, please contact me right away so that I can contact the advocacy organization that's scheduling these meetings for us. And then also you need to determine what ask applies to each legislator. So because you're going to be meeting with all of your legislators, you might have a different ask for each legislator. So my congressman has signed on, so my ask would be different than when I'm meeting with my senator, because my senator has not signed on and my congressman has signed on. So that's something that you need to watch in each meeting, that it may differ for each meeting. I would check your schedules often for last minute changes or cancellations. You usually will get a reminder email if there has been some type of a change to your schedule or a cancellation. And just be aware that that can happen right up until the meeting, because legislators are very busy and they have different things to do, hearings, markups to go to. So if something comes up, they may have to cancel, or they may have to switch to you meeting a staffer. Please take note that all meetings are in the Eastern time zone. So no matter where you live, they will always be the Eastern time zone, and you're going to have to convert to your time zone. And that's something that we've had an issue with a little bit in the past. So just try to be mindful of that as much as possible so that you don't miss your meetings. If you have any conflicting meeting times, or if there's a meeting you can't attend, please do not contact the legislative office. Contact myself at becky@nfed.org, and I'll be able to help you either reschedule that appointment or let the member of Congress know that you will not be attending that meeting. We don't want you to cancel a meeting. There will be, most likely be other members or other NFED families and ELSA coalition members that will be in those meetings. So we want to keep those meetings going, and we'll just let them know that you won't be able to make that meeting. I want to talk a little bit about effective storytelling. Many of the legislators who have signed on because they've heard a story from one of our advocates. And sometimes it's just one story that has made all the difference. It's the most powerful tool that we have in order to garner support from our legislators. And every time I'm in a meeting, I always hear other family stories, and I'm amazed at how many different issues that families are going through and how frustrating it is. And each meeting, I actually learn something from each one of the families, and it's really heartbreaking, but your legislators and their staffers need to understand exactly what you're going through. Explain your insurance coverage struggles or any type of insurance coverage struggle that you anticipate in the future. Speak from your heart and don't hold back. There's been many meetings where I've shared my son's story and what we've gone through and how frustrating it is, and what has happened, like the secondary health issues due to the delay in coverage or the denial. And I've broken down in the meetings and I've cried, but when you're sharing your family's story, like I said, make sure you speak from the heart, and they'll understand or hopefully understand what you're going through, and they'll be able to sympathize with you. Remember, each advocate will have approximately 1 to 2 minutes to speak. And as Kevin said, that may be a little bit more, a little bit less, depending on how many advocates you have in those meetings. So just be mindful of the time, and remember that there are other people in your group, and we want to make sure that each advocate has enough time to speak. Helpful tips. Make sure you focus on ELSA. Don't discuss other legislation or political issues. While you're in these meetings, you may think, oh, this is a perfect time or perfect opportunity to talk about something else that's happening in the world or other legislation. But this isn't the time to be doing that. We want to focus on ELSA. We want to make sure that the member's office understands exactly why we're there. And we don't want to bring up any other issues that could cause a problem and that could cause division in the meeting, and that would get us off course. So just try to keep that in the back of your mind and make sure that you always bring it back to ELSA. Some of the office staffers may bring up another piece of legislation, and what I usually do is I just try to refocus it back to ELSA so that we don't get off topic. As Kevin said, don't be intimidated. These are very laid back meetings. My husband and my children are in each meeting with us, and my 9-year-old just shared a little bit about how he wanted our legislators to support some legislation. And we also had my 2-month-old in the meetings that we held. So just feel free to have all of your family in those meetings, and just remember to mute if you are not speaking, so that anybody else who is speaking, they can get the time and that they need. Also remember that you are the expert on this topic, and you need to educate the legislators and their staff on the need for ELSA. Some members may never have heard of ectodermal dysplasias or whatever congenital anomaly that you have. So you need to make sure that they understand exactly what you are going through and how they can help you. Don't be, like I said, don't be intimidated. They're not going to know how they can help you unless you explain it. Always have notes, and your personal story, of course, are encouraged so that you don't forget something. As Kevin said, the legislative staff are very busy. They attend dozens of meetings every single day. Take time at the beginning of the meeting to connect with them rather than rushing into the information. So for example, I usually start my meeting by saying, hi, it's really nice in Wisconsin today. Have you been back to Wisconsin? Are you in DC right now? What's new with you? Or just something, like a little icebreaker, so that you aren't jumping in and just saying, hi, this is Becky. I want you to co-sponsor the Ensuring Lasting Smiles Act. We want them to be comfortable, and we want them to get to know our families. So after your meeting, it's important to build relationships. So under meeting follow-up, immediately after, there will be a survey on your online schedule, and we ask that you fill that out immediately so we know what offices to follow up with after your meetings. Within 24 hours, email the staff and thank them. I always mention, keep it really short and sweet, and mention how you appreciate them taking the time to meet with you. Add a picture, whether it be of yourself or your family or some type of dental work or whatever treatment that you need. You can be creative and add anything that will spark their interest in how they can help you and why they should help you. Follow-up is just as important as those legislative meetings. If you don't follow up, usually that legislative office isn't going to follow up with you unless you take the time to let them know how they can help you and that that meeting was important to you. If you don't hear back, email or call the DC office every 1 to 2 weeks. And something that's nice about those online schedules is that there will be the staffer's email address located on those schedules after you get out of the meeting, so you can contact them very easily. In regards to building relationships, I always like to say be persistent, positive, patient, and passionate. So as Kevin said, you always have to remember to be kind, and that goes along with those 4 Ps. We don't want to irritate the offices. We don't want to bother them too much. We want to stay positive. If you don't hear back from them, just remember that they are very busy, and it may be simply they have an overload of work and they can't get back to you immediately. So just follow up with them and let them know you're looking forward to hearing back from them. Don't argue, educate. We do not want to argue with offices. If they don't understand something about the Ensuring Lasting Smiles Act, it's our job as advocates to educate them so that they want to support ELSA and they want to help our families. Some offices just may not understand the specifics of ELSA. And if you don't have that information and you don't understand their question or what information to share with them, please feel free to email Kevin or myself, and we can always reach out to that office for you. Let the offices also know that you're a resource for further information. And like I said, if they get back to you and say they want information that you don't know about, reach out to us, and then a member of the advocacy committee will follow up with that office. Share periodic updates on ELSA. At some point, we're hoping that the Ensuring Lasting Smiles Act will go to hearings in the different committees it was referred to. So at that point, if we have different advocacy updates, that would be a great time for you to reach out to those offices and let them know where ELSA stands and how they can support moving ELSA forward. There are thousands of pieces of legislation introduced every year. ELSA is just one of them. You need to explain why ELSA should be a priority to your member of Congress. They see tons and tons and tons of pieces of legislation every day, and they need to know why they should pick ELSA out of all of those thousands of pieces of legislation, and why they should make that a priority for our families. Why is it important? What will it do? And it always comes back to this patient stories. Patient stories will help ELSA become a priority. As far as social media posts, I would make sure to tag your legislators. A lot of legislators do check their social media, and that's a good way to get their attention and make sure that they know what's happening with ELSA. And then also, it's a great way as a follow-up to let them know you appreciate that they met with you. So we're going to go into questions quick. I just wanted to say thank you to everybody for advocating for ELSA, and it's going to be a great year. This is just the start of it.
Awesome. So I'll read a couple questions that I see here. Dr. Karen McAndrew, who's a phenomenal provider, takes extremely good care of my boy Cannon. So I'm glad to see her on this right now. The question is there coverage for government plans or self-funded plans? Or are these still exceptions for coverage under medical insurance? So government plans, such as Medicare, Medicaid, federal employees, Veterans Affairs, VA, those are not included in ELSA, but self-funded plans are. And some folks might be wondering what those are. Essentially what what ELSA does include is the group and individual private insurance markets. So the group market is employer-sponsored coverage. That's where a majority of Americans and their dependents receive health insurance, is through their employer. So yes, ELSA does apply to that. It includes the individual marketplace. So that's folks who don't get employer-sponsored plans or the government plans. Sometimes you can buy it directly from the marketplace, the ACA marketplace. That is included in ELSA. So yes, self-funded is a subset within the employer-sponsored coverage. So yes, self-funded is included, but federal government plans are not. The next question is, what if we go 2.5 minutes or over? Do they cut us off? Regarding telling your story. Becky, do you want to take that one?
Sure. So you won't be cut off. Usually the staffer is very laid back and will let you talk as long as possible. But remember, you will have a set amount of time. These staffers have meetings one right after another. So that's why I'd kind of mentioned to be very mindful of your time and keep track of it, because we want to make sure that every advocate that is in the meeting will have enough time to speak and share your story. So that's why I also said try to keep your story brief and practice sharing your story. Because sometimes when you're sharing your story, there's so much you think is important that you want to try to get in, and then you end up going 5 or 6 minutes and taking other advocates' time. So just be really mindful of the time and keep it brief, but cover the key talking points and the important stuff.
And the next, we got 2 questions on the same topic, but just a question about whether the slides or the video recording of this will be sent out after this training session. So either Becky or Leah, if either of you could discuss how that will be shared after this.
Yes, there will be an email that is sent tomorrow that will have the slide deck available and also the recording of this video, so that you can rewatch the video if you want, or if you want to just go through the slide decks to look at different information or find the links that will be available as well.
That's the only other question that I'm seeing right now. Yes, to Leanne's point, other reasons for insurance denial is exclusion of benefits. That's right. Yeah, the insurance can be very creative in finding ways to deny medically necessary treatments of congenital anomalies. So ultimately, ELSA will ensure that these private health insurers are required to approve. You know, it probably won't happen overnight. And I always tell some folks, like, once this law passes, it gives us some ground to stand on, the legal foundation to stand on. So, you know, if for whatever reason your insurance provider would still deny treatment after ELSA is signed into law, it makes the appeal process a lot easier to have this legal foundation. And ultimately, we're just going to make sure that we educate as many of these insurance providers as possible, so that way they know how to handle these situations. Let me go, just had a flood of emails coming in. When is the next meeting, the next training session?
So the next training session will be on April 19th. And that one will go into much greater depth about the different meetings. And then we'll also have a mock legislative meeting, so you understand exactly what you should expect and how they usually go. We will also have another representative from the advocacy organization that's scheduling the meetings, and he will be going through the schedules and how to access them, the different information that you can find on your schedule, how to find a key talking points, and then how to use all of the different features of those online schedules, including the survey, and also following up with the member of Congress through their staff email.
Next question. There's one from Tanner and Amanda Upchurch. Is there any language in the bill about coverage for doctors being in network or out of network? Answer to that question is no, not right now. And we don't anticipate that being added. There's a broader policy debate going on the Hill about whether you can mandate what they call gap exceptions for insurers, to essentially say, like, if I don't have a local in-network provider and I have to go out of network, will you still charge me at the in-network rate? That's a larger policy debate. So that type of language is not included in ELSA. But I think through ACA revisions, I think anybody can request through their individual insurance provider to make a gap exception, but that language will not be included in ELSA. Will we know who the other advocates are in our meeting ahead of the meeting? Becky?
Yes, with the online schedules, this year there's an added feature that you will know ahead of time when you receive the schedules who is in your meeting. And then there will also be an area for a lead for those meetings. So if there is the lead that is mentioned on that schedule, then that person will lead the meeting, and they will try to keep everybody moving in order so that everybody has enough time to talk. And then if you are not a lead, then usually you will find out ahead of time so that you can contact, or if you're a lead, you can contact the other members of your group to try to work out a game plan for your meetings.
Next question from Chris Quigley. Kevin, you said government plans will not cover including Medicare, but what about Medicare Advantage plans, which are purchased from private insurers? Wondering about coverage for people over 65 with these anomalies who need continued care. I don't have an answer for you on that right now. Becky, do you have one? We might have to get back to on that.
We will have to get back to you, Chris. I would mention though that ELSA is the first step in trying to get all plans covered, and that once ELSA is covered, we do believe that all plans should cover the treatment of congenital anomalies. And I mean, that's our ultimate goal. So that's why it's so important to get ELSA passed so that we can continue on this mission to make sure all plans are covered.
All right. Next is it in Energy and Commerce Committee? So yes, that is one of the 3 House committees where ELSA has been referred. The other 2 are Education and Labor and Ways and Means. The Senate has the HELP, which is called the Health, Education, Labor, and Pensions Committee. But yes, Energy and Commerce is one, and we have an awesome lead sponsor from Energy and Commerce. Congresswoman Anna Eshoo is the chairwoman of the Health Subcommittee at Energy and Commerce. So she's leading our bill effort in the House. So we feel really good about it. Next question, let's see. Do we know if we have Florida Senate support for ELSA? So as of now, no. The 2 Florida senators have not co-sponsored, but that's not to say that they won't support the bill if it comes for a vote. So that brings up a really good point. I want to mention this. Co-sponsoring a bill is not the end-all be-all, right? So we're extremely excited about all of the co-sponsors we have for ELSA. But if for whatever reason your member of Congress is unwilling to co-sponsor the bill, that's okay. That does not mean they're going to oppose the bill or vote against it. So again, it's all about building relationships, staying in communication with them, make sure you're always positive. Even if they turn down co-sponsoring the bill, that's okay. We still need their support when the bill comes to the floor for a full vote. So please don't turn negative against the office if they turn down co-sponsoring, because we still need their support when the vote comes. Let's see, anything else? How long does the whole advocacy procedure last? Becky, do you want to take that? It's kind of an open-ended one in terms of, I don't know if it's targeted towards Virtual Day on the Hill or the whole ELSA advocacy timeline.
Sure. So I'll, in regards to the Advocacy Day on the Hill, it is a one-day event. However, depending on how many meetings you have, it may only last 45 minutes to an hour. Each meeting is usually about 15 to 20 minutes. The issue that we run into, though, is that your meetings may not be back to back. They might be scattered throughout the day. So we always encourage everybody to try to take as much time during the day, just in case you do have meetings there. Some of them are before noon and some of them are afternoon. So you have enough time. In terms of the full advocacy journey, we have started, I would say probably about 3.5 years ago on this advocacy journey, where the bill was written, introduced. It has now been reintroduced twice. And we don't know how long this will take. We are hoping that the 117th Congress is our Congress and that we will get this passed in the 117th Congress. We do have quite a bit of strong bipartisan support, and we fully do believe that we can get this bill passed. So it's going to take everybody advocating together, though, and sharing your stories to make sure that we do get it passed in the 117th, and that we can continue to garner enough support so that it will get passed.
All right. And we got two more, well, I guess one question about April 19th again. Could you just recap the time? Could you recall the time for that?
Yeah, so the second training webinar will be April 19th at 6 p.m. And that webinar will be approximately an hour, and then we'll take questions again afterwards. And that one will also be recorded. However, I would suggest, if there's any way that you can make that webinar, to attend, because like I said, there's going to be a lot of information about how to access your schedule and how to get all the information for your meetings.
And the next question, I think the last one that I'm seeing right now, just to clarify, if I have a meeting scheduled at 8 a.m., but I'm in California, that meeting is at 5 a.m., correct?
So that would be correct. However, we have talked to the advocacy organization, and they're going to try to take into consideration the different time zones. So if you are in California, they're going to try to schedule them later in the day. So hopefully you don't have a meeting at 5 a.m.
And that is all the questions I am seeing right now. I know we owe the one about Medicare Advantage plans, but Jen Steele did mention that Medicare Advantage plans follow Medicare for medical billing. So if that's the case, then ELSA likely would not have any legal foundation in affecting the billing of that. But we'll send you a dedicated follow-up to that, just to be 100% certain. And yeah, I think that's it. If you all have any other questions, our emails are on the line, on the slide right there. Feel free to reach out whenever. Hopefully, if you have Facebook, hopefully you're members of the ELSA advocacy group, and feel free to type any questions or comments there as well. We're always willing to address anything that you have. So yeah, we're really excited. I do see one other, any plans to include government programs in the future? Yeah, like Becky mentioned, we're always ELSA is just the first step. So the idea is, once we have this legal foundation set into US code for private plans, we're gonna work with our bill sponsors and try to figure out a way to address the government plans as well. And we will you share the one pager? Yes, so the one pager will be included. It'll definitely be included, I think, in your emailed schedule. So once you sign into the Advocacy Associates, that's who's scheduling these things. Once you log into their platform, it'll have resources such as the one pager.
And we will also be sending the one pager, as well as some patient story documents and some other supporting documents to the offices ahead of the meeting. Also with a little brief explanation about the Ensuring Lasting Smiles Act and why we're advocating for it, so the offices will be aware of why you're on the Hill and what ELSA is. So that should help.
Cool. Awesome. Well, thank you all. I'm just really excited. I'm extremely excited to get started formally with this Advocacy Day on the Hill. It's usually a tremendous event, and even virtually, we can make a lot of progress. Thank you all so much for being willing to advocate. Becky, anything else?
No, it's just an amazing opportunity to be able to advocate, and like Kevin said, even virtually. there's a little bit more time that you have instead of having to worry about members running from meeting to meeting, since they're doing it virtually now. So let's all take this opportunity to share our stories. And this is the first event of the year, and we want to make sure that we garner enough support to push ELSA forward as fast as possible so we can get it passed. So thank you, everybody, for joining, and look for that next email about the next webinar. Have a good night, everybody.